Hi, I'm Dr. Carol Clark. I work with gender dysphoria, and I work with sex addiction and other addiction, and I also work with sex offenders. And today I'm going to talk about when is it gender dysphoria, addiction, or paraphilia. So the short answer is gender dysphoria is about gender. Gender is between the ears, and that's one sense of self as male, female, or anywhere on that continuum. Addiction is obsessive, compulsive, out of control behavior done in spite of negative consequences, self or others. So basically, when we engage in some kind of behavior that is an escape from pain, a striving towards pleasure, and doing something that gets all that dopamine going in our brains, and it becomes obsessive, compulsive, and out of control, and there's negative consequences, that's addiction. Paraphilias, or paraphilic disorder, paraphilia is some kind of arousal template, arousal object that is usually unusual, atypical, outside our bell curve of what's normal. And it's for the purpose of having sex. It's for sex. So it's for sexual gratification and arousal. And there's a real separation between having sex and being emotionally connected to another person. Okay? So gender dysphoria is about gender. What's my gender? Addiction is about doing something that's out of control as an escape from pain. And paraphilias are about doing some kind of behavior that's for sexual gratification. Okay? Sex addiction, just to back up, is not about sex. It's about addiction. So a sex addiction just means that someone is behaving addictively and there's some kind of sexual behavior that is the drug of choice. Okay? So dysphoria, addiction, gender dysphoria, addiction, and sex. Okay, so how is this important? Well, if I happen to be somebody who works with sex addiction, for instance, and I am, somebody comes to see me and they say, oh, I think I might be a sex addict, or I'm doing these behaviors that are causing me problems, and I don't know what this is all about. And maybe those behaviors have to do with I need to dress up all the time as a woman. Maybe this is a person who's presenting as male and saying, I have this problem. The only way I can get sexually excited is to dress up as a woman. And I need to decide through evaluating, getting history, really talking it through, is this person really female? Do they identify as female and dressing up as a woman is a way of expressing that? Or are they doing it addictively? Somehow, maybe when they were a teenager, they were playing around dressing in women's clothing and paired that with sexual feelings because they were teenagers. And so that gets paired, and then they do it more and more and more because it really feels good. And there's some underlying trauma that leads to a need to escape from pain. I'll say more about that in a minute. Or does it become something that this is the go-to for me? This is the one thing that really turns me on. And it doesn't matter what else, who I'm with. It's all about this is what I have to do to get sexual gratification. And how we treat that is going to be different. How we treat each of these is going to be different based on what it is. Because if we're treating gender dysphoria, then we're looking at helping this person transition to however far or wherever they want to go. Typically, we might have someone who was assigned male at birth who comes in and started cross-dressing, dressing in female clothing, and it became very sexual for them. But underneath all that, they really want to transition. And maybe that person was bullied and harassed and told, you can't do this. This isn't good for you. You're defective. There's something wrong with you. And so that pain of feeling defective and unloved leads to doing addictive behaviors. Cross-dressing may be part of that, maybe drugs, alcohol, looking at pornography, all these things could be part of that. Okay, so we have gender dysphoria that can lead into addiction. But then we might have somebody who is doing this, and for whatever reason in childhood, somehow it got hardwired into the brain. So we have someone who's doing this cross-dressing or dressing in the clothes of the other sex in order to gain sexual gratification. And maybe this person is with a female partner, or a male partner for that matter, who says, you know what, this isn't working for me. That every time we have to have sex, you have to do this. And maybe this person is doing this and can't find a partner because this is all they do, and they can't find a partner who's into doing it all the time. So those are the kinds of things that bring people into therapy. They're gender dysphoric, they want help transitioning, they're addicts, and their lives aren't working out because they're engaging in out-of-control behavior. Or they have a behavior that is separated from their sex and love, have a real separation, and they are either doing something that's illegal, as we see with some paraphilias, if they're actually acting out, or their paraphilia has to do with cross-dressing or something else to do that looks like gender, but it's really that break between sex and love. And they're with a partner who, again, says, you know what, I can't live like this, that I'm being objectified. It doesn't matter whether you're with me or with someone else because this is the behavior you're doing. And how we treat that, are we helping them on their gender transition? Are we helping them get into recovery from addiction? Or are we helping them just navigate their paraphilic behavior and see if there's some kind of compromise with a partner, see if there's some way of moving off this so that they can be more engaged with a real person? You know, that's really going to depend on the person.